Eastern Ontario has been facing a staffing crisis in the healthcare system, which has been exacerbated due to the COVID-19 pandemic. Understaffing within health organizations has hit an all-time high, with 23,000 job openings just in Eastern Ontario. The Skills Advance Ontario Health Project was launched to address the staffing and skills crisis in our healthcare system. This Employment Ontario project is funded in part by the Government of Canada and the Government of Ontario. Led by St. Lawrence College and delivered in partnership with the 5 colleges under the Eastern Ontario College Consortium to provide accelerated free training programs for 1,200 job seekers and incumbent workers within the healthcare sector. The project required the creation of 6 operational teams. The central administration team, led by St. Lawrence College, was responsible for the overall partnership, financial management, reporting, industry liaison, marketing and communications, and curriculum development. Each of the 5 regional college teams were responsible for developing and delivery of training and outreach of their local communities, for recruitment of training participants and employer support. In total, 2,800 participants have been trained since April 2021. The EOCC partner colleges have trained hundreds of job seekers and incumbent workers. The Cité has trained over 200 participants. Fleming College has trained over 550. For Loyalist College, they have trained over 325. St. Lawrence College has trained over 800, and Algonquin College has trained 1,100 participants. Some of the high-demand training programs included critical care nursing, acute cardiovascular life support, perioperative nursing, PSW, U-First dementia care, immunotherapy, food service worker, and office admin healthcare. As part of the project, 26 new curricula were developed in approximately 15 areas of content to further address the need of current, relevant, and most demanded skills required in the healthcare industry. The training was free of charge for the participants of the SEO Healthcare Project, also supported by the EOCC to invest over $800,000 in lab equipment and facility upgrades, all to ensure that the training provided is relevant to the current needs of healthcare employers. Some of these investments include upgrades to health labs and new equipment such as patient beds and mattresses, stretchers, sinks, curtains, simulation patient mannequins, surgical medical instruments, a respirator fit tester and phlebotomy lab and hematology analyzer, and computers in the Health Information Management Lab. The SAO Health Project has been a huge success. Out of the 2,800 individuals who have participated in training, 2,200 were employed workers, while 660 were new job seekers. To note, more than half of them fall within the ages of 20 and 40. The Eastern Ontario College Consortium began this project in April 2021 and are proud of their accomplishments to exceed the project's mandate by the end date of December 2022. Over 170 employers in Eastern Ontario have benefited from the program as well, with their employees participating in upskill training. Some of these employers include the Queensway Carleton Hospital, the Ottawa Hospital, Kingston Health Science Centre, County of Renfrew, Quinte Healthcare, Cornwall Community Hospital, Villa Marconi, Belmont Long-Term Care Facility, and Winchester Hospital, to name a few. The overwhelming response by healthcare employers and workers to participants in training demonstrates the urgent need to equip healthcare workers with skills and abilities to address the new demands of the healthcare sector. A well-trained workforce can help support the whole healthcare system. Participants who have gone through various training programs recognize how this project provided them with an incredible and valuable opportunity.
Obviously, resources are tight for all healthcare organizations, and we find that education sometimes gets sloughed off or gets pushed to the side, and this allows us to still revitalize our staff with education.
The ability to have these courses and then to have the understanding and try and help and support the frontline staff has been very beneficial to our organization.
Got a lot of positive feedback from people who had the availability and the flexibility too, I think was really good. We have lots of opportunities that are available to you, and so it's an industry that is certainly looking for good people.
The results of this project have changed lives and will continue to do so, not just for the participants, but also for the many communities and residents in Eastern Ontario.